I'm Casey. I am owner and physical therapist here at Ripple. Ripple is definitely the opposite of like traditional physical therapy. It's very open-minded and progressive and unique to the person in front of us. And I think that allows us to treat the whole body in a way that is focused on somebody's goals and not just an area of pain. It's really focused on them and what they're trying to achieve, and us just being a part of that. We're just really their guide, and they're doing the work, and we're here to support them in a long journey, not just out of pain, but beyond that too.
I am Julianne Funch. I'm the clinical director of our Back Bay location at Ripple Physical Therapy. I'm a physical therapist and athletic trainer. What's different about Ripple is that patients have the opportunity to be heard, and they also have therapists who are very much motivated to help them reach whatever goal it is that they're trying to reach, by also assessing them in a holistic manner, not zeroing in on one joint, really looking at them as a person to understand their root causes of pain. So we're able to work that out and then work well past that.
My name is Daniel Negrone. I am the clinic director at Ripple Physical Therapy in Brookline. I'm a physical therapist and a strength coach. The Ripple philosophy is a progressive but specific physical therapy and training approach that holds the patient's needs and goals at the front and center of our plan of care.
I've taken the word physical therapy off of a lot of our signs and branding for the reason that people have something in mind when they think physical therapy, and it's often linked with healthcare and an approach they've gotten in the past. And here it's just so different. It's definitely engulfed in so many different things, and depending on which of us you see, the experience is even different from there, because we're using our degree as doctors of physical therapy to figure out exactly what somebody needs, and that can look like training or treatment or progressive or injury prevention, but we're treating the whole person and not just one thing.
So culture is something that's really important to us here at Ripple. We have a great group of physical therapists who are like-minded in their mission to give quality care and continue to raise the bar in their own knowledge base.
I want every patient to know that I'm going to do everything that I can possibly do in every given session to try and get them out of pain and get them into a better position so that they can get back to doing the things that they love and get back to living a pain-free and happy life.
I think coming here is a ripple effect. Just like the name, we're working on small changes for bigger changes down the line. Working on a few little things to start, those areas of pain translate to bigger goals and bigger goals and bigger goals, and continuing to work through that pathway gets people past just the initial goal that they came for, to lift their arm overhead without pain and brush their hair, but get back to squatting and deadlifting and going to run a marathon, and all sorts of bigger changes that just happen from treating the whole person holistically and finding that root cause and letting everything kind of work its way out, just like the ripple.